I'm Isabella, I'll be your student nurse today. Can you
Hi.
state your name and date of birth for me?
Isabella Kwiatkowski, March 16, 1975.
Can I check your wristband? Okay. So I closed the door and I just did some hand hygiene for your privacy. Can you tell me what month it is?
November.
Okay, and then can you tell me where you are?
Doctor's office.
Good. So client is alert and oriented ×4. She has good upright posture, good hygiene. I'm just going to check your hair really quick. Not seeing anything abnormal. I'm going to check your skin for temperature. Good temperature. And I'm going to check right here, just a little pinch for turgor. Good. So the 3 assessments we'll be doing today are skin, respiratory, and musculoskeletal.
Okay.
So we're going to get started with the respiratory. Have you had any lung diseases or anything I should know of? Asthma or anything?
No.
Do you use tobacco products, smoking, anything like that?
Not at all.
Okay. So first thing I'm going to do is I'm just going to check your pulse. Okay, so her respirations were 18. So what I did was I checked your pulse, while I was actually counting your respirations. Otherwise, you would have altered your respirations for me. Okay. So first thing I'm going to do is I'm just going to palpate your chest, if that's okay.
Okay.
Okay. Then can you stand up for me so I can do your back? Okay, and you can sit back down. Her chest is symmetrical posteriorly and anteriorly, and inspiration and expiration is equal both sides. Just take a deep breath in. Good. Okay, so now I'm going to percuss. I'm just going to tap on your chest. I'm going to have you stand up for me, do your back. Okay, you're all good. So now I'm just going to, you can sit back down. I'm going to listen to your lungs, so when you feel the stethoscope, just take a deep breath in and out, okay? Okay, and I'm gonna have you stand up for me, and I'm gonna do the same to your back. Okay, you're all good. So what I was checking for was any breathing abnormalities like wheezes, crackles, or stutter, and you didn't have any of that, so you're
Great.
good. So now we're going to move on to the musculoskeletal system. Do you have any joint pain, arthritis?
No.
Anything that should concern me? Any
No.
like weakness or anything?
No.
Okay. So I'm going to start by putting my hands on the side of your cheeks and just open your mouth, close it, and then put your chin in and out. Good, and side to side. Okay, now, any pain with that?
No.
Okay, so now I'm gonna put my hand here and just push against it. Good. Other side. Good. So your strength is good. Can you just put your head side to side like this? Look up to the ceiling and then down. Ear to shoulder. Good. Any pain with that?
No.
Okay, you can stand up for me and face that way. Put your chin to your chest. I'm just gonna feel your spine, your neck. Okay, and you're all good. It's straight. Okay. Now we're going to do your shoulders. You face me. Arms out like this, and all the way up, and behind your head like that. Good. And then back down, and then straight in front of you and up, and then all the way down and back like this. Okay, good. Any pain with that?
No.
Okay. Can you just push up? Good. I'm going to palpate here. Any pain or tenderness?
No.
Okay, I'm going to peel down. Skin temperature is still good. I'm going to check your elbows for any wounds, lesions, any skin abnormalities. Not seeing any, which is good. I'm gonna go down to your wrists and your hands. Any pain in your hands,
No.
fingers? I'm gonna check your capillary refill. Good. I'm gonna check the other hand. Capillary refill. It's good. And then you can put your fingers like this. I'm gonna check for clubbing. And you don't have any of that, which is good. Can you bend your elbows? Okay, and then back out, and then turn your wrists in, back out, and down, hands out, wrists down, back up, hands, just your fingertips, go. Any pain with that?
No.
Okay, and now make a fist again, and then push up, good, push up, good. So now I'm gonna have you lay down, I'm gonna palpate your hips next.
Okay.
Any pain or tenderness with this?
No.
Okay, so now I'm gonna have you bring your leg out, good, and up, good, and then bend your knee. I'm gonna turn it in, out, any pain?
No.
Good. Now I'm gonna have you push in against, good, and then push out, good. Same thing on this side, out, up, good, bend your knee, twist it in, out, any pain?
No.
And then push out against, and then push in, good. Any pain with that?
No.
Okay, so now I'm gonna go down to your feet. First thing I'm gonna do is check for edema. And we don't have any of that on this side. And none on this side, so no edema bilaterally. Gonna check your ankles and feet. Any pain here?
No.
Okay. Okay, now I'm gonna have you touch your toes to each other. Good. Any pain with that?
No.
Okay, and then put your feet in. I'm gonna have you turn in. And then the other way. Good. Now I'm gonna have you push against my hands. Good. And then push up. Good. Now I'm gonna have you sit up against the edge right here. I'm just gonna palpate your knees. Any pain with walking, any tenderness?
No. Not at all.
Good. And I see that your leg hair is distributed evenly, which is good. Can you put your leg out like this? Good. And other leg? Good. Any pain?
No.
Okay, you can stand up. And have you do the same thing, but out and then up like this. Good. Out and then up. Good. Any pain?
No.
Okay. Now I'm gonna have you do walking down and back. Good. And the next one's gonna be heel toe walking. And then tippy toe walking down and back. Good. Now I'm gonna have you stand shoulder width apart, big feet, cross your arms, cross your chest, and stare at the wall right there. I'm just gonna observe for a few minutes, or for a second, sorry. Okay, good. And then next thing we're gonna do is the same thing, but I'm gonna have you shut your eyes. This time my hands are gonna be here. And if you're swaying a little bit, I'll just tap you on the shoulders, or I'll catch you if necessary, okay?
Okay.
Close your eyes. Okay, you're all good. I was just checking for swaying, but your balance is all good.
Okay.
So the next thing I'm gonna have you do is I'm just gonna be staying there as I observe your spine. I'm looking laterally at the curvature and it looks normal. So I'm gonna be faced that way. I'm just gonna palpate your spine, making sure that it's straight. Not feeling any bone deformities or anything. Normal curvature. Your chest is symmetrical on the back side. Now I'm gonna have you bend down and touch your toes. Your spine is still in a straight line. Your back is still symmetrical. You can stand up now. Now I'm gonna have you put your hands on your hips like this, and I'm only gonna have you rotate your upper body. Keep your hips still. Good. And then go side to side. Good. Any pain with that?
No.
No? Okay, good. So that concludes our exam today. Any questions for me?
No. Thank you.